our privilege and honor to have you. As you know, this is a very, very important and salient series of webinars for us. It's bringing, our chair's vision has been to take this knowledge and remove it from under lock and key. We feel that so much of this science and knowledge should be available to everybody, to all the families. And what you are doing with us today, it helps make sure that not just worldwide, everybody who is involved as a stakeholder of Rupani Foundation, but our beneficiaries, our families we're working with here, refugees in the USA, can directly benefit. And it's so very, very meaningful. It's very, very meaningful. Thank you.
My pleasure. My pleasure. Thank you.
Good morning, everyone. Welcome and thank you all for joining us for today's webinar on Pediatrics and Neonatal Care, presented by Rupani Foundation USA. I am your host, Dilshad Meghani, Community Outreach Coordinator with RF USA. The Rupani Foundation helps parents and children to reach their full potential to transform communities they live in. To achieve its goals, RF adheres to these core values and beliefs. Here at RF USA, we work with mothers to try and establish healthy routines for their children. RF USA holds yearly prenatal healthcare events, monthly sessions for expecting mothers, and sessions for parents on various emerging themes. And due to the pandemic, we have shifted our sessions from online webinars and instead of holding in-person sessions. Thus, the reason we have gathered here today with Dr. Asad Rahman. Our webinar is titled Pediatric and Neonatal Care. Neonatal care refers to the newborn infants from the time of delivery through about the first month of life. The term neonate is used for the newborn infants during this 28 to 30-day period, and the care refers to the diet, activity, hygiene, and disease prevention in newborns. And we are very pleased to have Dr. Asad as our guest speaker to share with us all the important topics today. Before we get started, I would like to first go over today's webinar agenda with you. First, we will be going over webinar etiquettes to assist you in participating in today's event, followed with an introduction for our guest speaker and panelist. After the introduction, we will give our guest speaker, Dr. Asad, the opportunity to share his presentation about pediatric and neonatal care with us. We will also ask you all to actively participate by answering some poll questions throughout today's presentation. At the conclusion of our speaker's presentation, there will be time for questions and answers from the attendees. So this is where you will be able to ask the questions you have been safeguarding the entire presentation. Excuse me. Let's go to webinar etiquettes. Attendees will be muted to ensure clarity for guest speaker and panelist. We ask that you please use the chat function at the bottom of your screen for any technical issue you may be experiencing. Have a question? Simply use the Q&A box in the control panel on your screen. You may send your questions at any time during the presentation. We will collect these and address them at the end of the webinar. Please be sure to ask to all the panelists and attendees. We ask that you remain patient as you await a response from our panelists. We ask that you take a minute to complete brief survey at the end of this webinar. Last but not least, we will be gifting a baby bag for those participants who attend the entire webinar, answer the poll questions correctly, and fill out the survey at the end of the webinar. Remember, you must correctly answer the poll questions to be eligible to receive the baby bag. Excuse me. I'm excited to introduce today's panelist. Thank you all for joining us today. Let us start with the chairman of Rupani Foundation today, Mr. Nasruddin Rupani. Chairman Rupani is a highly energetic person with a lot of passion for community services and humanitarian programs. His interest in promoting community service activities make him a high respected figure in many countries. Mr. Rupani considered the high importance of human life and early brain development from the conception stage. We highly appreciate your commitment to serve the community, and real social services can be learned from this great community leader, Mr. Nasruddin Rupani. Thank you very much for making the big difference. Next, we have Amit Motwani, CEO of Rupani Foundation. Mr. Motwani.
Hello, good morning here in the US, and good evening to those of us on the other side of the globe, joining us from Pakistan and other areas of Asia, South Asia, and all of the continents around the world. We welcome you and have a special thanks for Dr. Rahman for joining us today in our series of webinars, which are targeted toward maternal and caregiver health and child development. On behalf of our chair, world-renowned philanthropist, and our founder, Nasruddin Rupani, we thank you all for joining us. And again, special thanks to Dr. Rahman for bringing this caliber of expertise to share with all of our beneficiary families, as well as those of you around the globe who are joining us today. Thank you.
Thank you, Mr. Motwani, for your support and leadership. Now, I would like to introduce our today's guest speaker to you all a little bit further. As I mentioned, Dr. Asad Rahman is a senior consultant, pediatrician, and neonatologist, MBBS, King Edward Medical University, FCPS, Pakistan, DCH, Glasgow, UK, and Fellowship Neonatal Medicine, McMaster University, Canada. Dr. Asad belongs to the most beautiful and far-flung mountainous part of Gilgit-Baltistan. Dr. Asad has more than 22 years experience in pediatrician. After completing his MD, he joined Aga Khan University Hospital, Karachi in 1999 for his postgraduate training in pediatrics. Currently, he is working as senior consultant in Sultan Qaboos University, Muscat, Oman. In his whole career, he involved in training medical students and postgraduate training in academic activities. He has published many researches, articles in international journals, and has participated in international conferences. So before I turn it over to him, I would like for you all to answer a quick poll questions that pops up on your screen. I think you can see the question on your screen. So it's about how long should newborns breastfeed after birth? So you have 4 options. So you're gonna choose your answer from there. Yeah, I can see the big participation from my attendees. Great. Thank you all for participating in our first poll. So now I will show you the results. So you can see the result on your screen. So according to my first poll, I have 11% participants are agreed with 1 year, and 22% are saying that 6 months, and I have 67% are agreed with 16 months. So thank you for sharing your ideas and your answers, your responses with us. Now I will turn it over to Dr. Asad. Dr. Asad, the floor is yours now.
Good evening. Good evening here in the East and good morning in the West. Thanks, Ms. Dilshad, for a nice introduction. And thank you, Mr. Meghani, for that warm welcome. First of all, I would like to thank the Rupani Foundation, the CEO, and Ms. Dilshad. She had a great communication skill, like she was able to communicate with me and arrange this great event. So thanks, Mr. Chad. We will start our presentation now. And let me go to, okay, share.
Did you get it, Minister Rahman? Oh, great.
Can you see it?
Yeah, you can see.
Okay. Okay. So, actually, the topics which were chosen are like really nice and very important. So, and it's like my interest also in these topics. So it's good to share my experience with you. So let's go through without wasting any time. So first of all, like we know, like it says various parts, the presentation. So the first thing we are going to discuss is the breastfeeding. And we will go through the nutrition of a baby in first 6 months, and then nutrition from 6 to 12 months. And then the common nutritional deficiencies. And at last, we will be touching base with the like the pandemic we are facing nowadays, like how to protect our children from COVID. So first of all, nutrition during the first 6 months of life. What is important? Why it is important? It is important because it's the time where there is fastest physical and mental growth of the baby happens. Secondly, it's the time where the programming of our body happened, like of a child for his whole life. So it's very important period, very critical period. So if you do the right things there, it will stay with the baby throughout the life. And then it is a critical period for our organ maturation. So it's very important to take care of the baby's nutrition during this first 6 months. So what are the important nutrients we need to focus on? What the baby needs is like proteins, carbohydrates, fats, iron, calcium, vitamin D, zinc, and other vitamins. What to feed? The most important thing is to choose what to feed. Like breastfeed is the best feeding, of course. And if breastfeed is not available for some reason, it's the formula feed. So it's in red, that no fresh milk, no cow milk, no buffalo milk, no goat milk till 1 year of life. So till the baby completes 1 year, we should not give any of those milks because those are not enough, and rather might be harmful for the baby. Why breastfeed? So the plenty of research has been done. Like, it's natural, of course, whatever nature choose for us, that's the best. And the research is like, they show that the breast milk is superior. World Health Organization and other organizations about the child health, they recommend exclusively breastfeed for 6 months. Exclusive breastfeed means only breastfeed, no other fluids, no other milk. Only mother's milk, as I said, no other liquid. If mother milk is not available, give formula milk. So of course we can mix. If mother milk is not enough, just give some mother milk, and you can add a formula milk also. So what are the benefits? So we will go through the benefits of breastfeeding. First of all, the first thing is the stomach and our gastrointestinal tract or gut. So it's easy to digest. It has the best protein, best carbohydrate, and best lipids. So it's easy on baby's stomach. It causes less constipation, it causes less diarrhea, and it causes less spit ups or vomiting. In premature babies, it protects it against a very nasty disease called necrotizing enterocolitis. So it's a protective factor. On the other hand, if we feed formula, it's a risk factor, not only like it's not protective, but it increases the risk. So that's how the breast milk is important. If we go to the other things, like we look into the infections, it's always said that it's the first dose of immunization. Colostrum contains a lot of antibodies or immunoglobulins. It reduces diarrhea. It reduces ear infection, upper respiratory tract infection. It reduces meningitis, and it reduces pneumonia. So it's a natural protection and natural antibodies, or you can call antibiotic or whatever. So it protects from these all infections. So if we feed our baby with the mother's milk, so it causes low incidence of allergy in infant and children. Even in adult life, it reduces the incidence of eczema and atopic dermatitis. It reduces the incidence of asthma, and incidence of cow's milk allergy resulting blood loss in the GI is also less. Not only during the childhood or during the infancy, or like not only in 6 months, 2 years, the benefits are there through the whole life of the child, and once he becomes adult, it will persist. It's an antioxidant. It contains a lot of antioxidants, which reduces the risk of many cancers. There is reduction of risk of diabetes. There is reduction of risk of obesity. So we can see the benefits later in life also. Good for eyes, and it reduces the retinopathy of prematurity in premature preterm infants. So it has a great effect in reduction of the risk of death. So reduces the infant mortality rate. It reduces in sudden death, infant death syndrome, and it causes reduction in the cord deaths also. What are the effects on the brain? It's great for the brain. Why? Because this is the only milk which has the certain elements or constituents and good lipids for the brain development. You know that you cannot get those in the cow milks, or you cannot add anything in a formula milk. Like only out of 100 elements, they are like successful to put 3 or 4, but not yet, and we don't know those 3 or 4 are how effective those are. So Why it's important in like a human child to have the breast milk? Because the human brain develops after delivery. The animal brain, which is almost fully mature once the calf or an animal is born, so it's all it doesn't need to grow after birth. So naturally, the animal milk doesn't have all those uh, good lipids and good constituents which help the brain growth. So these many compounds are present in the breast milk, which improve brain development and IQ. Not the benefits are only restricted to the mother, the baby. There are benefits for the mother also. It reduces the immediate bleeding after delivery because of the hormonal excretion, secretion, hormonal surge after the baby sucks, and then it relaxes the mother, and that has a positive effect both on the mother and the baby. It improves the bonding of the mother with the baby, and it reduces the risk of cancers in the mother. Just the most important cancers are like breast cancer and ovarian cancer. And it also reduces the bone diseases later in life for the mothers, like that's osteoporosis, like later in our life, our bones become weaker, and it's more in females. So it reduces the risk of osteoporosis. The mothers who breastfeed has less osteoporosis. Now, if we see the other thing, like it's readily available, no need to prepare. It has the ideal temperature. You don't need to warm it or reduce the temperature. It's clean and cost effective, of course. You don't need to spend any money on it. If mother milk is not available, for example, if the mother is sick, there's milk is not available for various other reasons, and the mother's on some medicine or something, and then we should give the baby formula milk, not fresh milk, not cow milk, not goat milk, because those are not suitable for the baby. In formula milk, although the formula milk is made from the cow milk, but it has gone through a complex process to bring as near as possible to the human milk. It's not possible yet, but the researchers are doing their best to make more suitable for the babies. So no fresh milk till, I emphasize on the no fresh milk till 1 year of life. That's not good for the baby's stomach. So just a little comparison. If you see in the breast milk, there are the best proteins, best carbohydrates. There are essential fatty acids and lipase, which are not present in the cow's milk and the formula milk. In formula milk, of course, you will have partially added. And carbohydrates is like the best carbohydrates, and there are anti-infective agents, as I said, the immunoglobulins and antibodies are there. And the growth factor, of course, it's not present in the cow milk and formula milk. And there are plenty of vitamins which are suitable for the child's digestion and growth. So what science says, like it recommends exclusively breastfeed for 6 months at least. That's the recommendation from both the World Health Organization and American Academy of Pediatrics, which says 4 to 6 months. And after that, you need to add like the supplemental feeding, or you can say weaning. And of course, you need to continue feeding as long as possible, ideally up to 2 years. So 6 months exclusive breastfeed is the recommendation. In addition to all of these, the mothers will have prolonged lactational amenorrhea. So that's like the natural protection for getting pregnant again. And then it's recommended both in developed and developing country to breastfeed the baby. That's from the World Health Organization. So what to do after 6 months? And after 6 months, of course, you need to start weaning the baby. So weaning like to solid food slowly and gradually. And what to do, like there is a, like it's a very long topic, but like to summarize, start a single food, for example, single grain, for example, take like rice or wheat or whatever, and or a single fruit, and try for a few days, like 5 to 7 days, the same food, and then go slowly. Eat the second food after 5 to 7 days, because you need to see that what is the effect of it, and is there an allergy or something. In the beginning, of course, the baby is not used to the new food, so you have to grind well, and then once the baby is getting older, and once he is trying, he's tolerating the grind food, you need to mash, and then you go to finger food, and then of course by 11th or 12 months family food. Expose your baby to more and more food, because this is a critical, as I said, it's a programming time. If you expose, there is maximum exposure, the baby will develop the taste. This is the best time. If you delay in exposing to maximum food, it will create a problem later in life. These are very common questions. Can I give egg? Yes, in the past there was like not recommended before 1 year. Now the latest recommendations are yes, you can give after 6 months. Fish, yes, you can give. Nuts, yes, you can give. But of course, the consistency you have to make it with the is the child tolerates. Cow milks, no. Cow's milk, no. And other milk like fresh milk, no. Sugar, no. Sugar is bad for the babies. Don't eat any sugar, or don't give any sugary juices and food for the babies to protect the baby's teeth. No salt, no added salt till 1 year, because the salt is bad for kidneys, and the salt is later bad for the hypertension, blood pressure. So don't give salt till 1 year. Honey, no honey, because honey can cause a bad disease called having bad germs, which can cause which can be very dangerous for the baby. Like it's the Clostridium botulinum. Okay.
Yeah.
That's the end of the first session. And so I would give the mic to Dilshad, and I'll just stop sharing.
Yeah, thank you, doctor. Thank you so much. After your presentation, I came to know that how much the breastfeeding is important for the babies. And thank you for that. Again, if you have any questions, you may ask them at any point during the presentation in the Q&A box, and they will be answered at the end of this session. So after learning so much, learn about the impact of breastfeeding during the neonatal period, this transition perfectly into our second poll question. So let me insert my second poll question here. Okay, so I'll give you a moment to click on your responses. So the question is about what vitamins are most important to newborns. So there are like 4 options you have. So waiting for your responses. Great. So almost the responses, I got it. Yeah, I can see your participation. I really appreciate that. Okay, almost I got it. So let me share your questions with you and your answer, sorry. Okay, you can see on your screen that 15% are saying that vitamin A is most important, and I have 8% are talking about iron, and 8% are saying that vitamin A, B, and C, and we have 69% are agreed with vitamin D and iron. So thank you so much for your participation. Now to discuss nutritional deficiency in infants, I will once again let the speaker to take over. So Mr. Asad, I want you to go over. Thank you. Let's go. Are you looking for your second presentation?
Yeah.
Yeah.
Okay. Can you see it? Okay.
Yes, we can. Thank you.
Okay, so really impressed with my audience. They are so educated, like the most important, like every vitamin is important, like vitamin D and iron are the two most important deficiencies which we get in the first year. So like I'm going to talk about those two. So I'm really impressed with how good our audience and the mothers are. Who know already what I'm going to talk. So first of all, we are going to talk about, okay, vitamin D, right? And then
Yeah, I think it's right. After the break, it's gonna be, yes.
Okay.
Yes, you got it.
Okay. So like, what is vitamin D? It's a very essential vitamin or nutrient, and it's needed for our healthy bones and teeth. It's needed for calcium absorption. It's needed for phosphate and magnesium metabolism. It's important for our immune system and immune regulation, and it reduces the risk of autoimmune diseases, which is like it's quite common, like including type 2 diabetes, and it also reduces infections. Okay, so we are going to talk about vitamin D first, and then we will go to the iron. So what are the types of vitamin D? We have two types of vitamin D. One is D2 and the other is D3. So vitamin D2 comes from the food, like fortified food, egg, fish, mushrooms. And vitamin 3D is made by our body when it's exposed to the sunlight. So our infants are, when the newborns are born, they are like deficient in vitamin D stores. They depend mostly on breast milk, and which is dependent on maternal vitamin D. So if the mother is vitamin D deficient, the baby will have low vitamin D stores, and this is a very common deficiency even in the pregnant and pregnant mothers also, and the one who just delivered. The breast milk content of the vitamin D is often low, and the sun exposure is restricted in many areas because of various reasons: cold, hot, high altitude, cultural reasons, and dark skin pigmentation is also another limitation. So our babies are always vulnerable for vitamin D deficiency. So what is the result of vitamin D deficiency? It can cause bone weakness. It can cause rickets. That's like equal to osteoporosis in the babies. And it can cause seizures or fits, and it can cause difficulty in breathing because of muscle weakness. And again, it can cause muscle weakness, aches, pains in the baby, and bone fractures also. How to prevent vitamin D? So the breastfed or partially breastfed infants should have supplemental vitamin D since birth till 1 year of age. It should be around 400 international unit, per day. And if the infant is fully formula fed, usually formulas are fortified with vitamin D, you don't need. But if it's partially formula fed, you need to see how much formula the baby is taking. If the baby is taking more than 1 liter of formula, then you don't need to give vitamin D supplement. If the baby is getting less than 1 liter, you have to add vitamin D drops to the baby. So like breastfeed all babies and partially breastfeed also all babies, and fully formula fed or the one who are getting more than 1 liter, you don't need to give vitamin D supplements. What are the vitamin D rich food? You can see the nice sushi. Fresh fed fish like salmon, that's the oily fish, like many oily fishes that there, you can search which are the one, and the liver, mushroom, egg yolk. So you have to add more vitamin D rich food once the baby is starting to eat. So can you harm your baby by giving a lot of vitamin D? Like it's very rare and it needs very high dose. Like it's like 100 times high dose than the normal therapeutic dose. So it's very, very rare, but it can happen. If it happens, it can cause nausea, vomiting, abdominal pain, muscle weakness. The calcium level in the blood will go high and it can cause kidney damage. So you can check the vitamin D level in between, but if you get just the proper dose, even if you are giving with the formula, it will not cause toxicity. Our next important nutrient is iron. So what is iron? What is iron deficiency? Like briefly, we'll go through it and I'll give you the important points. So what is the role of iron? Iron is a major component of our hemoglobin and in our red blood cell. It helps the oxygen to reach to the body tissue from the lungs, and it helps the muscle to store and use the oxygen, and it is an essential nutrient for child's growth and development. It's very, very important. The more they are doing the research, the more they know that it's an important element. What are the sources of the iron? During the pregnancy, if the baby is born in full term, like at 9 months, at the last 3 months, like the last trimester, the baby starts storing the iron. But if the baby is premature, then he cannot store and then he will be deficient. So it's mainly the source is from the mother. After birth, the baby uses the stored iron, sorry for that spelling, stored iron, and there is iron in the breast milk. And the iron in the breast milk is in the best form, although it's low, but it's almost fully absorbed. But the iron in the cow's milk will not absorb, only like 10 to 15%, like up to 20% will be absorbed. So in the premature babies, the iron is, the stores are less. And again, the breastfeed also is not like enough iron. It's good iron, but not enough. And if the mother is iron deficient, it is further low in them. So the premature baby needs iron from birth. So iron in milk, like iron in the breast milk is the best one, which is easily absorbed. The high amount of vitamin C in the breast milk helps absorption of the iron. And the breast milk, the breastfed babies don't lose iron throughout to the first year of life. So because they don't have the cow milk allergy, cow milk can cause loss of iron through loss of blood, so iron deficiency can happen. And the iron in the cow's milk is not easily absorbed. And again, the cow milk causes loss of iron in the GI. So what are the risks of having iron deficiency? If your baby was premature, if your baby is exclusively breastfed for more than 6 months, if you were iron deficient during your pregnancy, if you have diabetes, if you were smoking during pregnancy, so those are all risk factors for iron deficiency. So what are the effects of iron deficiency? It can cause anemia or low blood, low red cells, low hemoglobin. It can cause poor growth. It can cause difficulty in breathing. It can cause poor appetite. The baby will feed less, and it can cause slow or growth of the brain. So it has effect on IQ and brain also. So the researchers have looked into this, and they have come to know that the iron deficient babies or children are like a bit behind in the IQ, and they are slow in learning the social and emotional skills, and it can also affect how the baby, even the little baby, can learn, for example, to learn to hold the things, to learn to smile, to learn to have stranger anxiety. All those effects can be seen in the babies who are iron deficient. And those effects, if you treat properly early, it can be reversed. But if there is long-lasting anemia, the effect can be long-lasting, even life-lasting. They last for life. Okay, so what are the recommendations? So it's recommended both from American Academy of Pediatrics and WHO that they should be exclusively breastfeeding full-term infants receive an iron supplement of 1 milligram per kg per day starting at 4 months, and should be continued till the baby gets good iron containing food. All preterm babies should receive supplemental iron from first month of life, and infant who receive formula, usually the formulas are fortified with 12 milligram iron per liter. They don't need supplements of iron. And then there should be screening for anemia at around 12 months of age. So for first 6 months, your baby is safe if you are breastfeeding. Even if you're formula feeding, the baby is safe for iron. For after that, you have to give supplement, and also you have to give iron-rich food. Don't give cow's milk again; it can cause iron deficiency. So cow's milk is not good. The fresh milk is not good till 1 year, before 1 year of life. So these are the iron-rich food. It's meat, chicken, pulses, beans, lentils, peas, dark greeny leafy vegetables, for example, spinach, broccoli, and oily fish, eggs, and then the food which is fortified with the iron and sweet potato. These are like many of these food you can start when you start weaning the baby at 6 months of age. Okay, I think we are taking a break here.
Thank you again, Dr. Asad, for the very valuable information on nutritional deficiency in infants. Let me take you to my last poll now. So I'm going to insert my poll question here on your screen. I'll give you a moment to collect all of your responses. I think you can see on your screen. So the question is, what are the best practices to take with newborns and mothers during the COVID-19 pandemic? You have 4 options. The first option is about sterilize breast pump equipment and surface regularly. The second is frequent hand washing. The third one is limit number of person-to-person contact. And the last one is all of the above. I can see your big participation. Okay, great. Thank you for your participation. So you can see on the screen your results. So according to this poll, I have 8% participants are saying that frequent hand washing, and only 8% are again talking about limit number of person to person contact. And I have 83% are talking about all of the above is the right answer. So thank you for your participation. We will now move on to our speaker's final part of his presentation on how to adjust childcare needs throughout a pandemic. Okay, so let me call Dr. Asad.
Thanks a lot. Impress you again with the answers. How educated audience we have. Okay. So like taking care of your baby or your children during the pandemic, like this, the COVID pandemic we are talking about. And so what should we do? So first of all, a little bit about what's going on, latest research and about the babies. Mostly I'll talk not about the adults, and especially the newborns and the babies below 1 year of life. And to date, like in the newborn, if we see the virus has not been found in the amniotic fluid. There is no virus in the breast milk of those mothers who are positive for the COVID. And there is no transmission during birth. So I was just going through another paper. It was published. I just read it today in JAMA this month. They did a very nice research, and they looked into the mother's milk, like breast milk, to the mothers of the mothers who got vaccinated. So they looked into the antibodies of those antibodies in the amount of antibodies in the breast milk. So it's very nice to know that like there was the high amount of antibodies were present in the breast milk. And so like the babies are protected because it's not transmitted from the mothers, first thing. And then if you are vaccinated, it goes through the breast milk to the mother. So that's an amazing news, and researchers and scientists are very happy with that. Okay. So at birth, if the mother is suspected COVID-19, mother and infant should be able to stay together. They should be allowed to do skin-to-skin contact and kangaroo care. They should be rooming in throughout the day and night, so they should stay together. And immediately after the birth, even if you are suspecting COVID, you should allow the mother to feed the baby, and let the mother to take care of the baby, whether the baby is mother is having COVID-19 infection or suspected. Okay, again, what other practices should be observed? Like, of course, the normal practices, social distancing, frequent hand washing, masks, and all other hygienic practices to prevent infection. Keep breastfeeding if the mother is breastfeeding, and if pumping, should should they follow the best practice like washing hand before and after pumping, and cleaning the pump, sterilizing the all the equipment. So this is if the mother is having suspected COVID, or the babies even. If the baby is bottle fed, again, follow the best practice for preparing the formula, sterilizing the equipment, and limit the number of people who feed your baby. Of course, try that if healthy person should feed the baby, and frequent hand washing with soap and water, and routinely clean and disinfect the surfaces, and avoid the separate of COVID-19 through the respiratory droplets. That means you need to compulsory put the mask on while caring for the baby. If you are positive, if the mother is positive with COVID-19, nothing much difference here. She needs to continue breastfeeding, but frequent hand washing before and after feeding, or holding the baby and putting the mask on, and then avoid touching the eyes, nose, and mouth of not only yourself but the baby also. So it's all, again, the all hygienic measures, but you need to feed the baby. Don't keep the baby with yourself, with you, like don't isolate the baby from yourself. And it's important to keep the mother and baby together, even if the mother is positive. Skin to skin contact is encouraged and should be supported by the family and the caregivers. Well, if you are pumping, wash the hands before and after expressing milk, or touching the all the equipments, bottles, and also caring for the baby, and follow the best practice for cleaning the equipments again. For all caregivers, if possible, to have a healthy person care for and feed, for care and feeding the baby. And all caregivers and helpers should do follow hand washing and mask and social distancing and everything. And if formula is used, again, the best practice for preparing and sterilizing the equipment. If the mother is severely ill, even in ICU, in a separate room, try to keep the baby with the mother. Unless until, like if the baby mother is on ventilator or like really sick, it's life-threatening for her or for the baby, then you can. Of course, it's, but still the experts recommend that don't separate the baby from the mother, even the mother is positive and sick. Of course, the mother will need a help from a healthy person and caregiver. How to talk to our children about the pandemic. So remain calm. This is like, of course, about the bigger children. Remember that the children will react to both what you do and what you say. Reassure them that they are safe. Let them know that of course, it's upsetting, but you need to reassure them that it will go away. They are safe. And you should be always available to your children, to listen to them, to talk to them, to explain to them what's going on around, and then make sure that reassure them that they are in safe hands. And avoid blaming others, blaming other people, blaming your neighbor, blaming your children, like children, friends, other people, other countries, whatever. So just don't use those kind of words. And the information should be accurate and appropriate for the age. Don't scare your children, and just reassure them. So again, you have to teach your child about everyday actions to reduce the germ. Remind the children that they need to wash their hands frequently, and they need to stay away from people who are sick or coughing or sneezing. They need to sneeze into a tissue and properly dispose it, and if in the schools are open, follow the guidelines, whatever the school has. So it's very important to teach them that what they need to do, but they should know everything about COVID in a age appropriate manner. So with that, we come to the end of our presentation. Thanks a lot for your participation, and thanks to Rupani Foundation for giving me this opportunity to talk to the parents and just to share my experience. Thanks a lot.
Thank you so
much. If any questions, just.
Yeah, thank you so much for sharing your fruitful presentation with us. So now we will open the floor for all of your questions. We got so many questions in our Q&A box. So let me open these questions and I'm going to share with you. Okay. I have a lot of questions. There are some questions are very similar to each other. So let me go with the questions. We have a different one. So there is a mom, she's asking about her daughter that she's 5 years old and after her birth, since day one, she fed it by the other milk. She never has the mother milk. She has the powder milk. Can you ask the doctor about the consequences she's asking about? So what would I do now? She's asking. Maybe she wants to clear that.
Okay, so she did the right thing if it was not available. So as I said, the second best option is the formula milk, but it's not ideal, but it's the second best option of of course, if you don't have the first option, then you need to go for the second. So the formula milk is, they have brought is colos is possible to the breast milk. So, and then of course, you need the supplements like vitamin D and iron, as we discussed. And then the most important thing, after 6 months, you need to wean the baby. So hopefully everything went well. And now 5 years, the most important is it's a critical period. So like the early childhood development and going to probably preschool. So now the nutrition again, need to focus on and need to see, follow your doctor time to time and looking for any nutritional deficiencies and follow for the weight, height, development and everything. So it's important to just follow with the physician and assess the child, and hopefully everything will be well.
Okay, thank you, doctor, for sharing. So now I have another question, that why honey is prohibited to infant? Can you just elaborate this one for them?
Okay, the honey is one of the best, it's good for immunity for all of us, but it's not suitable for children because there is a chance of the Clostridium botulinum is one of the nasty germ which can stay in the honey, and it can cause, even we have seen severe diarrhea, deaths after giving the honey at birth to the children. I have my own personal experience that one of a mother gave honey at birth, the first day of, and the baby got infected, and it was positive. The germ was positive both in the honey and in the baby's stools. So it's well known. It can cause infection and it can be life-threatening. So that's why American Academy of Pediatrics don't, and all the experts don't recommend to give honey before first year of life. After first year, after 12 months of age, the baby's immunity gets mature, and then he will be able to fight with all those germs. So it's just the infection, to avoid the infection.
Okay, thank you. I have another question, that my son turned 2 now. Should I continue breastfeeding? How long he can continue?
Okay, you can continue up to 2 years. Ideally, what the researcher recommend is 6 months and then continue till the so what you can breastfeed the baby till 2 years of age. Try to wean, try to give more. It's after 1 year, the only milk is not enough for the baby, of course. So start weaning the baby from 6 months, and then more food, less milk, but the milk is very good nutrition also. So you can continue up to 2 years. And meanwhile, if the mother get pregnant, for example, the baby is 6 months, 4 months, and the mother get pregnant again, you can continue feeding till you deliver the next baby. Even you can continue feeding both the babies. So this is a very critical question also. So it's not like that the baby, it is made for the baby will become weak or something. So breastfeeding can be continued. It's very very good for the babies. So you can continue up to 2 years of age. No problem.
Okay, thank you so much. We got so many questions, but due to the time, we can't answer all of them. But remember, any questions we do not get time to answer will be followed up on our social media platforms. So thank you so much, Doctor.
Thank you, Dilshad. Thank you, the Rupani Foundation, Mr. Madwani and Mr. Lam.
Thank you. Again, thank you everyone for taking time out to join us in today's webinar. I hope you have learned many new things, and it's my humble request from you all to stay connected with us for our update on upcoming webinars. You can do this by liking and following us on our Facebook page. And let me share my screen. It's not gonna let me to share. So you can like our Facebook page, our Instagram, Twitter, and our YouTube channel. I would also like to thank you, our panelists, Mr. Nasruddin Rupani and CEO Amit Mutwani, for joining us today, and our honored guest speaker, Dr. Asad Rahman, for giving his valuable insight and such as informative presentation. I thank all the participants for joining in today's webinar, and big thank you to RF Team USA for their collaborative teamwork. Remember, we highly appreciate your feedback and your time of availability. Please take a few seconds to fill out the survey at the end of this webinar and let us know about your suggestions about our next webinar. Thank you, everyone. Thank you, doctor, and have a great rest of your day.
Thank you. Thank you, Dilshad.
Thank you so
Thanks.
much.
Bye.
Bye.